Okay, the purpose of this short video is to demonstrate how to measure right heart strain on a CT PE. So here we have a positive PE, a saddle PE, positive PE study, and we're going to look for evidence of right heart strain. We'll be utilizing the CT parameter of right ventricle to left ventricle ratio greater than 1, which is compatible with right heart strain. So the key factors that we need to take into account here is we will use the thinner slices, window the CT so we can comfortably determine the difference between the blood pool and the myocardium, and we'll be measuring with our ruler. Key point is we're measuring the largest diameter that we can find in the right ventricle with the largest diameter we can find in the left ventricle. So they will often be on different slices, and we will measure in perpendicular to the interventricular septum and make sure we're not measuring into the right atrium, which can give you spuriously large values. So we're looking at the right ventricle, and probably the largest thing I can find is probably around here. Measure out towards the myocardium to the interventricular septum. Now I won't measure the left ventricle value here because if I go further up it seems a little larger, and if I measure around here, if you get too high up you go into the left ventricular outflow tract and the aortic valve. So you're looking for this, focusing on the interventricular septum, probably about here, going all the way out here will give me a decent value. So I get 37 millimeters, and earlier I got 75 millimeters, and that would be a case where the RV-LV ratio is greater than 1, and I'd put that in my impression as evidence of right heart strain with RV-LV ratio greater than 1. So just to recap, main points are we're measuring perpendicular to the interventricular septum. We're measuring on different slices because we're determining the largest LV and the largest RV diameter. Being careful not to focus in the right, going into the right atrium, and that is it.